Good morning. It being 9 o'clock, I call the meeting of the Kane County Human Services Committee to order. My name is Michael Linder. I'm vice chair of the committee in absence of Chair Surgis. And today's date is Wednesday, November 12th, 2025. Clerk, please call the roll.
Allen, Garcia, Gripe,
Here.
Lewis, Tarver,
Tarver's here.
Surgeon, Linder,
Linder here.
Roth.
Roth is here.
With the use of your ex officio, you do have an in-person quorum.
Okay, we have a quorum and we have one remote request from Mr. Tarver. Any objection? Seeing none, Mr. Tarver is welcomed into the meeting and to vote. Entertain a motion for unanimous consent to approve the minutes of October 15th, 2025.
Lewis will ask for unanimous consent.
No objection. The minutes are
No objection.
approved. We have no names for public comment this morning.
Chairman. Ken Shepro, local historian. My comment is this date, November 12th, 1775. General Washington issued an order to discourage the colonels of regiments from each claiming bounties for enlisting new soldiers, and decided that the first person to proffer a new recruit would be entitled to the bounty. And he also made clear that, to quote from the general order, no officer, the officers are to be careful not to enlist any person suspected of being unfriendly to the liberties of America or any abandoned vagabond to whom all causes and countries are equal and alike indifferent. The rights of mankind and the freedom of America will have numbers sufficient to support them without such persons. Let those who wish to put shackles upon freedom and place their confidence in such miscreants on the other side.
We could perhaps adapt some of that into personnel policy.
Yes, I think, there's some other things in the personnel policy.
No
that
vagabonds.
pass muster today.
Or for running for county board.
Yes.
Let the record show that Ms. Garcia has joined us. Good morning. You haven't missed anything except the historian's report.
The semi-quincentennial minute.
Yes. Okay.
Yeah.
So,
Mr. Chair,
yes, sir.
since Ms. Garcia is here, you no longer need me as ex officio, but I'll stay.
Okay. Thank you. It's a pleasure to have you here, Mr. Roth. Okay. Monthly financial reports are on file. Any question about those? Seeing none. Jamie, to you, do you want to do this quickly or slowly?
Well, that's up to you. I'm here for you. So let me know what you need.
Well, give us the highlights. I know the Blue Cross bill has been trending up. Is it still?
It's an expected upward trend. They
Yeah.
renegotiated a bunch of contracts.
Right.
Prices went up. So it is stable to what we expect it to be, but it is still the higher. It's not going to go back down. I mean, this is where it's going to be now.
Yeah, everything's gotten expensive.
Right.
I paid $290 yesterday to have a dog looked at.
You need insurance.
David, risk management.
I give them kind of a rundown about the renewal as well. We kind of brushed over it in the board meeting because it was
Yeah.
quickly, but if you want to kind of let them know where that ended as well, that'd be helpful.
Liability thing.
Sure. So David Larson, Risk Manager, Human Resources. So yesterday at the county board meeting, we passed the resolution to renew insurance, worked with our new insurance broker Alliant to make some calculated decisions to lower our premium. and to adjust coverage to maintain kind of the risk tolerance that we had as a county. So I think that really well. We maintained some relationships with Safety National for workers' comp insurance to continue working with them. Found some new carriers for liability insurance as well. So overall, very happy with that process and look forward to working with these new carriers or adjusted coverage.
Good. I'm sure some of the underwriters look at the fact that we now have a risk management person and come down a little bit at least.
I'm told that helped to mitigate some of those costs. So, and
Sure.
having access to better confidence in the data that they received.
Thank you. Okay. And then staffing,
The reports are included in the file. If, I've just heard, some talk with, everything that's going on with the budget of wanting to hear more about staffing. So if the committee would like more detailed reports on staffing than what we have, or more detailed discussion, by all means, let me know what this committee is interested in hearing in regards to staffing. We've just kind of put the reports in and answered questions if you have it. But you can see kind of the hires and the terms in the reports. And if you have any questions on those, we're happy to answer them.
good, thank you. I hear from board members here and there, and sometimes from members of the public about the possibility of implementing an attrition policy. Might be useful if you begin assembling some sample policies just in case we want to talk about that. I think that's a drastic move that we may need to take looking at the county finances. I hope we don't, but I think we ought to have some of those resources at hand when we get ready to talk about it.
And we did that earlier this year, and ultimately the county wasn't ready to take that step. So I think we have it all ready. If the
Good.
board is interested in taking that step, I think we have it written and ready, and available for the board to provide input into how they would like it handled if they would like to take that step. So we're ready if that's the direction the board wants to go. You just have to let us know.
Good. I think that it will come up. Whether we go there or not is another question, but I think it'll come up. And compliance of monthly training report just there. Yep, Ms. Lewis, I'm sorry.
No problem. Back on staffing, I got a comment. Oh, sorry. A comment and a question. So on new hires, if any of these new hires are like a new position, maybe if we could note that, just so we know if any new positions are creeping in versus, a replacement.
Certainly, we can find a way to add that to the report. Ultimately, if anyone is to add a new position, new headcount, that has to go through the board by resolution. So it should be something that the board is aware of. So in terms of your departments, they cannot add new headcount without a board resolution. If you're talking about the elected offices, we do not have that information to provide it to you. They don't share that with us.
Okay, interesting. Wait, and my other question, that's interesting. Okay, when we're talking about our applicants, I'm on that page.
Mhm.
And like under state's attorney, we have an intern / volunteer. Can we separate those? Because as we've learned, an intern is paid and a volunteer is not. Could we,
If they're on the report, they're being paid.
okay, so they're not volunteers, so we could actually just take that part off.
If they're on the report, they would be, I can look into that specific one. But if they're on the report, it's coming out of our payroll systems. They're being paid. We do not report on unpaid individuals in this committee. So
Okay.
that would have to be a paid employee, but I will certainly look into that.
All right, thank you.
Let the record show that Ms. Ellen has joined us. We're now
Good
well
morning.
above a
Sorry to
quorum.
be late.
Mr. Gripe, I see you.
Thank you. Oh, go. Okay.
We
Uh,
see you.
I see you.
Nice
Yeah.
to see you. You look good
Next.
today, next.
I just to thank you back on the cost things. I know that you guys do a great job, and it's not, we love the risk manager, but it's not just the risk manager. It's everybody in HR that's clearly attentive to what's going on. And we have a prime example nationally of what happens when you don't watch what's going on, whatever you want to call it, universal health care, Obamacare was going up by 30% this year. Probably one of the most expensive things we do as a nation. But when you just pay bills, it goes crazy. When you do your job and you deliver great benefits to people, we can do it efficiently, and you guys do that. So thanks for doing your jobs way better than a lot of people do.
Yeah, thank you, Mr. Gripe. I think, Mr. Larson's been a great addition. We also have to give our executive director here some credit for having recommended that we do that and finding a good candidate, because it all comes together. Good. All right. No old business. Anybody have old business they want to bring up? Okay, a new business. We have a resolution authorizing Magellan Healthcare Incorporated as Kane County's employee assistance plan provider for 2020, not 2020, probably for 2026.
Yeah.
I just can't read.
This is the existing provider that we use. This is just approving our contract for the next year. With the expansion of mental health benefits being included in the county's health plan, we went back from 5 covered visits to 3 to save a little money. Employees can utilize the health plan with no out-of-pocket cost to them for mental health visits. So there's first dollar coverage there in response to that statute that changed. So we went back to our original 3-visit plan with the employee assistance plan, but it's still available. It includes appointment assist. They'll help people get appointments. It also includes expanded benefits well beyond mental health, everything from will writing to help with finding extended care for elderly parents. There's really a lot of services included in this, and Magellan's been a great partner in that, and it's a great program.
Thank you. So I have a motion and a second to further discuss and perhaps approve this. Ms. Allen.
Moves. Sonia second. Garcia second.
Okay. Yes, Ms. Allen.
I just wondered, can you give us an idea of how many people take advantage of this? Is it a fifth of our people, a third of our people?
It's more on the range of probably less than 100 a year. So I'm thinking maybe 10%. But we can go back and we can't tell necessarily everyone who's accessed the website, for example, with information, just those that have set accounts and logged in. So they will give us counts, but the pillar of this program is the anonymity of it.
Of course.
So there's full confidentiality in it. So we do not know who has reached out, for example, for mental health versus elder care versus financial counseling, things like that. So we don't get details, but that is kind of the function of the program,
Right.
is to not provide us those details. What they will give us is a head count of contacts.
Yeah.
And that I can get for you if you'd like in terms of recent numbers, but I would say it runs about 10% at last year.
Such a great program. I was just hoping lots of people were taking advantage.
We try to push more information out. We've tried to take more of an active role in letting people know that this is here, because it really is a great program and that it's not just for mental health. It includes lots of resources that and all of these services through this are at no cost to the employee.
Yeah. Well, if you're putting it out there and I don't pay any attention, and then one time I look at it and I go, oh, shoot, that could be helpful. So sometimes it's just being there and knowing it's there, and then we stumble
Yes, it's
And
good to
could-
have it. when
and could
people
use some
need it.
help. Yeah.
Yeah. Mr. Grape again.
Thank you, Mr. Chair. 2 questions. I remember when EAPs became a thing back in I think it was the 90s, late 80s, early 90s. And I would like it if we could get some general information, nothing specific, but categories. Because if there's an issue, let's say we're doing something as an employer that's creating an issue, and our, I don't know, pick a category, something that's going on in the county is higher than a lot of other places might be, that we could start to ask why and do what we can to fix it. So some kind of reporting doesn't have to be personal. I know it can't be, doesn't need to be, but if we get categorical kinds of commentaries, then we can do something about it, which kind of leads to my second point, which what Ms. Allen was talking about. I've always said that EAPs are like fire extinguishers. They're great to have when you need them, but I know the other day I was looking for one. We didn't have a fire in our house, but I was just like, I think we have a fire extinguisher. Where is it? And I actually had to go look for it. So I'm curious what Magellan will do for us to communicate and just remind people that we have a fire extinguisher. And then what we do to do the same thing, say, by the way, you don't need it today. You haven't needed it for the last 10 years, but you might next week. So here's where the fire extinguisher is, that analogy, that kind of thing.
We do have a Wellness Wednesday email that goes out to those who are interested. And we do have a flyer for it that we have posted with the labor posters and everything so that they end up in every break room in every office to make sure it's available there. So that's how we have made efforts to push it out and make sure people know about it and talk about it when we can. And when we hear from employees that have questions or concerns, remind them that it's available. But I will reach out to them and see what reports they can give us in terms of de-identified numbers. I think the most, when we've asked before, we get is de-identified numbers of people that they have contacted. Like these number of people have set an account in the website. This number of people have contacted us by phone. And that's all they will give us. I mean, as a function of the program, that's generally all they will give us.
All right. Thanks for asking.
When I was a union president in one of the local school districts, between the assistant superintendent for personnel and I, we finally were able to implement a program like this. And just the number of people who either, sometimes he would tell somebody, you know, you need to fix this problem. Here's one option for you. And those people often would come back and say, thank you, this has worked well for me. Or thank you, I got a good referral from them. And there's just a general feeling that it really worked. And it's the amount per employee is almost insignificant. When you multiply it by 1,400 employees, it's a lot of money, but it's a good thing to have.
Yes, I believe it's less than $1 per employee per month, so it's very cost effective. They also have a function with an employer mandatory referral that we have used a handful of times. So for example, and I'm just going to make something up here, you know, if you had an employee that you thought had a substance abuse problem, you could provide them a mandatory referral, which would require them to reach out to the EAP and follow their recommendations. And then as an employer, you get a notification that yes, they contacted us as you directed. And yes, they are following our recommendations. It still preserves the confidentiality of the employee in that we don't know what they're being addressed for. We don't know what the recommendations are. We just know that the employee has reached out to them and is following their recommendations. And then we get a notification when the employee is released from the program. So we have utilized that as well as a management team a couple of times.
Good. Any other questions on this?
Yes, this.
I'm sorry, Miss Lewis.
Thank you.
You have to make noise. I'm blind in my left eye.
Yeah, but you know, I'm so quiet.
I know.
So I just wanted to mention that on the actual resolution, it says that this contract reflects a cost savings due to reduction in the number of paid therapy sessions included in the plan in response to the addition of first dollar coverage of mental health in the county's health plan. So maybe we could kind of frame it with our employees that, hey, take advantage of these 3 free visits that you're going to get before you go to your doctor and sign up for an expensive $50, you know, visit or something like that. Because people love free.
And I think the idea behind, you know, if someone's, for example, looking for a counselor and you're talking about the counseling sessions, if you're looking for a counselor for a long-term issue or you want to establish with a counselor, you're going to want to establish with that person right away, the consistent counselor. You're not going to want to use one of their counselors and then switch. So I think for short term, I have a small problem. I need, you know, short-term address. That's when you utilize the EAP versus if you need counseling in your life in a long-term capacity, that's when you reach out to the medical insurance and get it put through the medical insurance. So I think that's kind of the hope behind it. If you just have something a one-off issue that you want to talk to a counselor a handful of times about, this is a great option for you.
But also so many people are afraid of counseling. And they, even if their doctor says, oh, you should see a counselor and I'll give you a referral, they don't want to do it. But they can do it through EAP because it's phone counseling. And they might get their 3 free sessions and then say, okay, I am going to go to my doctor now. So I think we really need to encourage all of our employees to get these 3 free sessions in your year.
Mhm.
Because you'd be surprised how much even 3 sessions might help you get through a problem.
Yes, absolutely. I think it's a great way for people who are unfamiliar with counseling to give it a try and see if it's a good fit for them. Because it really is, it's a great process. And like I said, it's confidential and it's 0 cost to the employees. So they do this without any kind of copay or cost share.
Anything further? Call the roll.
Allen,
Alan, I.
Garcia,
Garcia, I.
Gripe,
Great, yes.
Lewis,
Lewis, yes.
Tarver,
Tarver, yes.
Linder.
I do, yes. All right, passes. Similar resolution authorizing addition of an employee performance evaluation policy to the personnel policy handbook. Replacing one that is not there, right?
Yes, this is adding. It's not a replacement, it's an addition. So there is not currently a policy regarding evaluations. When we did the compensation policy a couple years ago, we did include that in order to give a merit-based increase, you had to complete an evaluation. This policy moves to require an annual evaluation of employees by their department, but leaves it up to the department primarily to determine how that's handled and what form they want to use.
Do we have some resources if a director comes to you and says, what's a good format? We have some resources to share.
Absolutely. We have a base form that we do provide them. They have the ability to either edit it to meet their needs, or if they already have a form they want to use, they certainly can continue to use the form that they want to use. So we are not currently mandating a specific form. We really have a lot of variations in what our employees do. I mean, we have highway workers and finance professionals and, maintenance staff and office workers. There's such a variation among the county staff that I think mandating a certain form would be counterproductive. So we allow the departments to adjust those forms however they see fit and use the form that they see fit as long as they are consistent in their department.
Is there a policy then that once the evaluation has been done, the written evaluation comes to the file in your office?
That this policy adds that. That was not, there were no evaluations in employment files previously. They weren't being forwarded over to the employee's personnel file. So this does require that they come to the employee personnel file.
Yep, thank you. Mr. Gripe again.
Again, what is it every time? It's
Well, it goes with the word gripe. And
Oh,
again,
okay, whatever. Again, I have a question. Respectfully, I think I might disagree, Jamie, on letting everybody develop their own form. I see where you're coming from. Makes total sense. But I'm playing this out because let's say we have 5 departments. We have more, but say we have 5 departments and there's 5 separate forms that have been developed by the directors in those different departments. And they set criteria through those forms. Those criteria could lead to terminations of employees or discipline or whatever. I think I could, and I might, if I was an employee that got terminated, point to another department and say, we work for the same county. We might have different jobs, but we have the same expectations to do our jobs right, to report on a timely bit, blah, blah, blah. And so my termination was unreasonable based on the fact that the criteria for this other department is arbitrary. That's what I'd call it if I wanted to file a lawsuit. And I think it would behoove us to have basically the same expectations. And if you write them well enough, and I've got some resources that are free that I can send to you. My last experience with using such a form was in a company with 65,000 employees, no 2 of whom did the same thing, some similar things, but it was written in a way that it could apply to anybody doing anything. and then had rankings so that when it came down and said, well, does your department director do this and ask these questions? No. Well, mine does. That's not fair. So I think, trying to keep us out of the litigation potential down the road, because people, when they get terminated for just cause, are going to get upset, and we should protect ourselves from that if we can by regulating at least the general format of this and not letting too much individualism, so to speak, pop into the form. So nothing, you can respond, of course, but I think we need to do that to protect ourselves.
And I'm happy to share the generic form we do have, that it does cover all your basic employment functions without getting into the details of the duties. And I think that, as departments use it, like that they all cover very similar things. In terms of terminations and protecting us from legal obligation, legal problems and terminations, we do have due process requirements, and HR must sign off on all terminations that make sure that they've followed the proper due process standard. So I think from a legal perspective, we're covered in that we are requiring a due process. For example, a performance-based termination would require some kind of performance improvement plan where we specifically outline the expectations and the results of not meeting those expectations, the criteria that are being used to grade them, and that each of them individually can stand alone in terms of surviving some kind of legal challenge. So, but to your point, if the board is interested in having a standard form, I'm certainly happy to share that standard form, and you can certainly add this as an exhibit and require that. That's entirely up to the board.
Is it automated or is it paper?
It's a paper form. It's not an automated form. A lot of our, we certainly could adapt it to a Laserfiche form. We do have the technology available to adapt it to that, or to give the option of doing it that way or via paper as they prefer.
We have some input from the Assistant State's Attorney.
Yeah, Ken Shepro, Special ASA. I would anticipate that the form and the policy would be reviewed by the Civil Division before final action would be taken.
It was sent to them. They might have some comments in between the committee process. So I did have a conversation with them. They just didn't have any comments prepared just yet. So ultimately, it's from a legal perspective, it's fine. From a language perspective, they said some language adjustments recommended, but that's kind of where we left it. But it was sent to the Civil Division a couple weeks ago, and they did have an opportunity to read it, and they will be providing some comments at some point.
Mr. Chair.
Go ahead, Ms. Lewis.
Thank you. Maybe we could gather the different forms that people are used and kind of look at them before we decide what the best form is.
Certainly.
Okay.
Ms. Juby.
Thank you. I'm not on the committee.
That's okay. That's why I called her Ms. Lewis first.
So I like the idea of a base template. To your point, the idea of a base template. I believe that the consistency in the template when it's determined for each individual job classification is way more important than a countywide template. I think that when you talk about someone saying, well, I had a different thing I am evaluated on. Yeah, you do. You have a different job. And so when you start making a one size fits all, it fits none. So I would suggest, in my humble experience, that we make sure that each department and division has a template that they use consistently, that allows for feedback by the employee, and that will be reviewed to see if it's giving the outcome. And also wanted to remind everyone that we do have a progressive discipline policy and we do have the due process. So the fears of not having a uniform policy should be outweighed by the fact that consistency, giving people set expectations that they have to meet, is way more valuable in terms of employee feedback and employee productivity and your end result. So I like that it's intentionally vague and allows the individual departments to determine what's important to them to actually meet their expectations and their goals. Thank you.
Anything further?
I just wanted to respond to one of the things that Mr. Juby said in terms of employees being able to provide comments and feedback that is included in here. But if it was the committee's wish that I add something in terms of an approval process for the evaluation form or some criteria around it, there is currently no criteria in here regarding the form, other than it's at department discretion. So if that was something you wanted to change, you'd have to let me know to change that.
What would make sense to me would be that at least that form be on file with you so that if all of a sudden a different format is used for one employee, we know that there's something going on. Hopefully that doesn't happen, so it wouldn't be a concern, but those whatever they're finally using should be on file with you guys.
Okay, yeah, I wouldn't think that needs to be in the policy, so I would recommend still going forward as written.
Yeah, I
I'm
agree.
sorry, we're having discussion without a motion. Is there a motion to approve this?
Lewis motions.
Gripe
Lewis
second.
I'll second.
and Gripe seconds. Okay, is there further discussion?
I just have another comment, but can we, could you gather the forms and let us see them at the next meeting?
Absolutely.
That'd be
Okay.
great.
That, I think that'd be great.
Good, thank you. Okay,
That won't hold up this process.
all right, clerk call the roll.
Allen. Miss Allen,
Alan, aye.
Garcia,
Garcia, yes.
Gripe, Lewis,
Lewis, yes.
Tarver,
Tarver, yes.
Linder.
Right. Motion to place reports on file.
Alan moves.
Lewis
Second,
seconds. Lewis,
all in favor, say aye.
Aye.
Aye. Okay, no need for executive session unless somebody knows something I don't know. So we'll entertain a motion to adjourn. We can
The
stay.
Unanimous consent for adjournment.
Objections? None? We're adjourned.